Vaginal bleeding or spotting during pregnancy. If you experience vaginal bleeding during late pregnancy, you will get a complete monitoring for signs of shock and blood loss. You will receive possible blood transfusions and for fluids. Also, there will be a fetal check for signs of distress. The possible treatment depends on the cause and age of the fetus. Placental previa. If this condition is the cause of bleeding, then doctors will always prefer to deliver the baby by cesarean. If you suffer from severe bleeding, you should go for an immediate delivery. If you have contractions, you will receive an effort to stop or reduce them. If your pregnancy is less than 36 weeks and bleeding is not severe, the doctor will monitor your blood count and baby's heart rate. You will receive a medicine to make your baby's lungs mature. When you reach exact 36 weeks, the doctor will again check for the condition of baby's lungs and accordingly you will have a delivery. In case of placental previa, all deliveries will be cesarean because bleeding may cause a high risk to the fetus. In rare cases, when the placenta is not covering the cervical region, then you can go for a normal delivery. Through a cesarean delivery, you will lose about 3 pints of blood from the body. Placental abruption. In this case, vaginal delivery is preferred over cesarean delivery. If you experience severe bleeding, you will have a cesarean delivery. If your pregnancy is more than 36 weeks, you will receive full medication for contractions to have a safe vaginal delivery. If your pregnancy is less than 36 weeks and bleeding is not severe, you will be hospitalized and checked for blood counts and baby's heart rate. Also, you will receive a medication to make your baby's lungs mature. Once they are mature, you will have a cesarean delivery. Uterine rupture. If the tests result in a uterine rupture, you will have an immediate cesarean delivery. Your surgeon may remove your uterus. But, if you want to have more children, your surgeon will go for the repair of the uterus. Also, you will require many blood transfusions since there will be a heavy loss of blood during the surgery. Vaginal bleeding during pregnancy, follow-up. After proper treatment, if you still notice any complications that may include abdominal pain, bleeding or fever, you should get yourself re-examined immediately. You may receive a bed rest with strict warning of not to place anything in the vaginal region. Avoid sexual intercourse. Do not use tampons until the bleeding stops. You should meet your gynecologist within 2 days of treatment. If you receive treatment for ectopic pregnancy and still notice pain or weakness, you should meet the doctor immediately. If you had molar pregnancy, you would require a regular follow-up of BHCG levels to check for any tumor. Vaginal bleeding during pregnancy, prevention. A great way to prevent pregnancy complications is to maintain a good relationship with your doctor and go for routine checkups. Note that this is important when you have had already experienced complications in your prior pregnancies. The second way to assure a safe pregnancy is to control the risk factors. You should completely cut down cocaine and tobacco. If you are hypertensive, try to keep it under control by taking the complaint to your doctor. A final word. Any bleeding during pregnancy, no matter when you experience, you need to call your healthcare provider immediately, only to confirm nothing is wrong. You should be prepared to give out the answers in detail about the amount, color and period of bleeding to help your healthcare provider determine the cause. If you had a miscarriage due to any of the above reasons, it does not mean that you are infertile. And know that you are not alone who suffer such a tragedy. Most women experience miscarriage at least once during their reproductive lifetime. Miscarriages can cause an emotional vacuum, but that is not the end of the world. You can become pregnant even after a miscarriage. A counseling session with the obstetrician or gynecologist is the best way to deal with pregnancy. All you need is a positive mindset and courage. Most of the time, a little spotting doesn't pose any health risk to you and your little one, though, bleeding can sometimes specify a difficulty with your pregnancy. If you are pregnant, you need to be conscious about your bleeding. If you experience any irregular bleeding or period during pregnancy, contact your doctor immediately.